next we have, sorry, that wrong thing, diseases of the testes, epididymis, and spermatic cord. So they're classified in two ways. You have the non-traumatic or congenital, because of course nothing has actually occurred, they're just born that way. So there's three examples: one testicle or a lack of testicles, congenital hyperplasia of the testes, so they're just small, and cryptorchidism, so one of the testicles is in the wrong place. They're usually located abdominally and haven't descended into the scrotum. The traumatic inflammatory neoplastic type, so there's testicular torsion, so twisting, orchitis and epididymitis. They kind of occur together because the epididymis is next to the I was going to say orchid, the testicle, and you have testicular neoplasia, which is of course cancer. So anyway, we'll talk about cryptorchidism first. What is it? Okay, so basically you can see a vet palpating here, and you'll see that only one testicle has descended. So that means one of the testicles is somewhere in the abdominal cavity of this poor dog here. And basically it's described according to location. So a cryptorchidism could be abdominal usually, it can be inguinal, it could be prescrotal, and usually basically you could, other ways to classify it could be from one side to the other. So it could be right cryptorchidism, meaning the right one hasn't descended. There's the testicle number that are affected, because basically I made a mistake. Anyway, so cryptorchidism, why is it important to talk about? Because it can actually lead to other diseases like cancers because of hormones, testicular torsion, and it can actually lead to undesirable behaviors like continuous spraying. And what you'll also see as well is sometimes feminine characteristics, because when you get neoplasia as a result of cryptorchidism, what you'll get is basically an increase in estrogen. So you'll see feminine characteristics like homosexuality, you'll see more estrogen being produced, so they might have larger nipples. And yeah, you can basically diagnose it by palpating it, honestly. Just kind of what I said here. So you'll palpate the testicle itself and feel that there's only one. And you won't be able to feel it in the abdomen often, unless you're just kind of lucky, but you can usually confirm it through x-ray, ultrasonography. But through ultrasonography you can also confirm tumors or testicular torsion related to cryptorchidism. So it's not just cryptorchidism, it's what it could lead to. And you can treat it basically through castration, but it's not just castration. You have to explore the abdomen to find the second testicle, because of course it's not descended, so it's somewhere in the abdominal, inguinal or prescrotal space. Now torsion, let's see if it's turning up. Yeah, okay, this is the best we can do. So yeah, this is usually seen in cancer cases. So you can see that this is actually a tumor that's been removed. And you'll see a lack of eating, vomiting, lethargy, abdominal pain. It can be mild or even marked abdominal pain. It varies. And again, it's quite similar. You'll do an abdominal exploratory operation. You can diagnose it through imaging. And you may be able to palpate the mass in the abdomen, but it's very unusual, same as cryptorchidism. And basically you can remove the affected testicles. You do the same thing in humans as well if, you know, they have the same issue. Now, orchitis and epididymitis, for some reason, has only one slide, but I think... Okay, yeah, I just wanted to show you a picture just to explain. So it's usually caused by trauma, an infection from the trauma, or even urinary tract infection, because just remember, you know, this is all related to the urethra as well. You'll see it's related to torsion in terms of its clinical signs. Not related, sorry, it's similar to torsion. So again, a lack of appetite, vomiting, lethargy, mild or marked abdominal pain. So just remember, torsion and orchitis and epididymitis have the same clinical signs. You can diagnose this with FNA, ultrasonography, biopsy, and an orchiectomy, but this is usually the treatment as well. And you can do cytology of the testis. Now, we'll go back to neoplasias really quickly. There you go. Okay, so there are a few types of testicular neoplasias. The most common are the Sertoli cell tumours and the Leydig cell tumours, and then finally you have the semimomas. Semimoma, let's see. I just want to see the classifications. No, I'm not reading all that. Okay, so what you'll also see is bilateral alopecia of the testicles themselves. I'm trying to find it. Yes, okay. So you'll see both testicles have a lack of hair. You'll also see alopecia on the abdomen, just cranial to it. You'll see prostatic cysts or abscesses, and you'll see penile atrophy and homosexuality. Now, in terms of what differentiates the two, Sertoli cell tumors lead to feminization. Okay, that's it. And in terms of treatment, of course, orchiectomy is best. You can also do a biopsy of larger lymph nodes near the undescended testicles, near the groin, and you can do a blood transfusion if the animal is anemic, and chemo for any metastatic cases.